Get started, I wanted to do a quick land acknowledgement, just to acknowledge that Fleming College is respectfully acknowledges that we are situated on the Mississauga lands and the traditional territory covered by the Williams Treaty. Chi miigwech to the Mississauga peoples for allowing us to continue our work in your territory. Um, and so after we've done that, I'm just going to now introduce my co-host. So I have the wonderful honor tonight of introducing Ashley Miller, who is the program coordinator of the practical nursing program at Fleming College. So Ashley started her academic journey at Fleming in the pre-health science program. Since then, she graduated from Trent University in 2007 with a Bachelor of Science in Nursing. Ashley started her nursing career in the emergency department at Ross Memorial Hospital in Lindsay. For those of you who might be from the area and familiar with the hospital, Ashley loves everything about the emergency department, from the staff, patients, families, the excitement, and fast pace. Ashley found working as a nurse at the bedside is very rewarding, so rewarding that she still works in the emergency department casually to ensure that she keeps up with her nursing knowledge and practices skills. Ashley is aware of what it takes to be successful with both asynchronous and synchronous program deliveries. After working a few years in emergency, Ashley started to work on her Master's of Nursing with a teaching focus through Athabasca University. This program was all done through distance education asynchronously. In 2018, after 11 years working full-time in a busy emergency department, Ashley took on a new exciting role at Fleming as the practical nursing program coordinator and professor. Each semester, Ashley is excited to onboard new nursing students, watch them learn and grow each term, and congratulate each of them as they cross the stage at convocation. So without further ado, Ashley, I will turn things over to you.
Thank you, Shannon. Miigwech, and welcome everybody to the Practical Nursing Wednesday webinar. We're happy to have you joining and participate with us here. This is tonight's agenda. We're going to go through a few of the different practical nursing programs that Fleming offers, as well as what types of hands-on opportunities you have within the program, where the nursing program will take you for a career. We're going to talk about Indigenous Perspective designation at Fleming, non-academic requirements, and then we're just going to finish up with live question and answers. So to start, there are a few different deliveries of PN programs at Fleming, and I see in the chat there that there's lots of different students looking at the different programs and their deliveries. The first one I'm going to provide an overview is the main one, which is our Practical Nursing Accelerated Program. The program code for this particular program is PN, and this program is offered 3 intakes every year, so fall, September, in the winter in January, and again in spring, May intake. And this program is delivered over 5 consecutive semesters. So it doesn't matter which intake you start in, you will continue for 5 consecutive semesters. There's no planned or scheduled break. However, if a student needs a break for any personal reason, by all means, they just reach out to the PN program coordinator, and we will advise accordingly. But otherwise, start to finish 5 consecutive semesters. This accelerated program is delivered in a hybrid delivery, meaning lectures are going to be either virtual or on campus in person, and they're synchronous. Synchronous meaning that you do have a timetable each semester, and you attend classes and labs and seminars as per your timetable. All labs and seminars are on campus each week for students to attend and practice in person. Clinical is on site at our clinical community partners. And I'm going to talk a little bit more about clinical a little bit later in this presentation. Another program that we offer, another delivery is the practical nursing, there's a spelling there, practical nursing PSW-PN bridge program. So students that have completed the bridging program through continuing education as a PSW, they can apply to come into the practical nursing program, and you start in semester 2 of the PN accelerated program. Again, this program offers 3 intakes every year, fall, winter, and spring. And this program runs 4 consecutive semesters due to starting in semester 2. So you do semester 2, 3, 4, and then 5. Again, there's no planned scheduled break in this program. However, it is an option for students to take a break if they need to. Like the accelerated program, the full-time program, it is a hybrid delivery. Lectures are virtual or on campus in person, and they are synchronous. You do have a timetable. All labs and seminars are on campus each week, and again, they are synchronous. And clinical is on site in Peterborough, Lindsay, or Cobourg at our community partners. For these 2 programs, for the full-time PN accelerated and full-time bridging program, the schedules are busy. There are lots of courses. There's lots going on in each of these programs and their deliveries. For semester 1 of the PN program, theory and labs are going to be timetabled Monday, Tuesdays, and Wednesdays. Yes, they are action-packed 3 days a week for the entire term. They are busy and they can start as early as 0800 or 8 a.m. And then clinical starts in the back half for semester 1. It starts week 10, and it is 1 12-hour shift per week for 6 weeks. So 72 hours of clinical in the first semester. And clinical is going to be either Thursday or Friday. So that's why your timetable doesn't have theory, labs, and seminars on Thursdays and Fridays for the term, because these days are saved for clinical. Starting in semester 2, 3, and 4, so this would be for the PN full-time program as well as the bridging students. Theory and labs and seminars are going to be timetabled Monday, Thursday, and Fridays. And that leaves clinical for Tuesday or Wednesdays. Again, clinical is 1 12-hour shift per week. However, for semesters 2, 3, and 4, clinical starts in week 3, and you have a total of 12 weeks of clinical. So you have 144 hours of clinical total for semesters 2, 3, and 4. Again, those weeks are busy, but you do have at least 1 day off each week. It just depends on which day your clinical is scheduled and which day you will have off. Semester 5 is a unique semester. There's no theory courses. It's all clinical. So each student has a 10-week consolidation placement, and it is completing 400 hours. And this is a great opportunity for students to even get a placement or a clinical spot closer to home if you live further away from the college. Students work with our clinical coordinator and our placement coordinator to see if they can get a placement closer to home. So that's always fun for students to have that experience. Another program that we have, or another nursing program delivery, is the part-time program. This program is developed for students that are have other commitments or working full-time. It is a we do offer 3 intakes of this program each year as well. Again, fall, winter, and spring. However, this program is 9 consecutive semesters. with an option of applying for a full-time seat after completing semesters 2, 4, or 6. So basically the full-time program is 4 semesters plus clinical. So each of those first 4 semesters of the full-time program is broken into 2 semesters. So 1 semester of full-time will equal 2 semesters of part-time, okay? But after semester 2 of the part-time program, if students feel that they want to flip into the program, they're more than welcome to apply internally through Fleming for a seat if pending, okay? Again, it's hybrid deliveries. Lectures are virtual or on campus each semester. And again, they're synchronous with a timetable. All labs and seminars are on campus each week and they are mandatory. Clinical, again, is on site at our Peterborough, Lindsay, and Cobourg and other local community partners. Part-time students and full-time students, they attend lectures and labs with each other. So we don't offer specific evening classes for part-time students. They actually are joined in together with our full-time students for each term. So that's unique and it's just a bigger cohort, but you get to meet lots of other students and engage with each other's learning. Semester 1 for the practical nursing part-time program. It's theory courses only, and they are timetabled Monday, Tuesday, and Wednesdays because they are joining our full-time students. So that's their timetable. It's not as busy as the full-times. We have more breaks, but you're still scheduled throughout the day, Monday, Tuesdays, and Wednesdays. For semester 2 of the part-time program, you will have theory again, Monday, Tuesday, Wednesday, but you will have clinical in the back half of your semester 2 starting week 10. And again, that's Thursday or Friday for those 6 weeks. Again, it's 1 12-hour shift per week for 6 weeks. And again, part-time students join up with the full-time students. The part-time program semesters 3 through 8. Theory courses are timetabled Monday, Thursday, and Fridays. And clinical will be either Tuesday or Wednesday for the 12 weeks of that term. Again, participating in clinical 1 12-hour shift per week for 12 weeks. And semester 9, that is your final consolidation, your final clinical placement. Again, it's 400 hours, approximately 10 weeks to complete these hours. And like the full-time students, you work with the clinical coordinator and the placement coordinator to see where you would like to do this placement. And it may even be closer to home where you are from. And that's always fun, like I said. Okay, so those are our 3 different three different nursing programs at Fleming and their deliveries to meet students' priorities and their needs. Within these programs, they all offer hands-on opportunities for you to gain those real-world skills so that you are ready and prepared to start your nursing career. Nursing skills labs, students will participate in 4 nursing skills labs throughout the program. The first nursing skills lab is your foundational skills, where you learn to do bedside care, vital signs. You start with some medication administrations, and then as you go from each semester to semester, the skills get more complex, more complex, and like starting IVs, caring for catheters, complex wound care, and all those fun skills. Clinical placement. There's 4 clinical placements plus consolidation for a total of over 900 clinical hours, which is quite a few hours to have at the bedside, to practice your skills, to practice your therapeutic communication with your patients and families and all of those. Clinical can be, and it will be at long-term care for semester 1, or it may be even at a retirement home in and around Lindsay, Coburg, and Peterborough. And again, those are 6 weeks placements. In semesters 2, 3, and 4, students will be in hospital. They could be on medical floors, surgical floors. They could do mental health. They may even do families care and so forth. And then, of course, then there's your final consolidation, where it just depends on where you would like to go, what type of care you'd like to provide. But those are all the options as well. Throughout the program, it doesn't matter which program delivery you do, there are on-campus simulation opportunities. There's simulations within the nursing skills labs that you take. There's also clinical simulations as well being developed and being active as we have now. So there's lots of opportunity for students to learn on campus in safe places, safe spaces, in small groups and labs, as well as in our simulation lab. And that's really what we really want to make sure, that students are safe and that they are in a caring place to learn. And I should say, like on the simulation part there, that our labs are small groups. There are a max of 32 students per nursing skills lab to ensure that we have the space and the equipment, but also so that you're working in small groups to learn your nursing skills as well. Clinical groups are smaller too. They're about 8 or 9 students per clinical instructor, while you're out in the first 4 clinical groups. Once you get to consolidation, that's one-on-one with a preceptor. So you just follow and work with your preceptor for those 400 hours. Career pathways. Jobs and industries that are waiting for you. They are waiting for you. There's lots of jobs and opportunities for our PNs, including working in the hospitals, nursing homes, extended care facilities, rehab centers, doctor's offices, and clinics. There's lots of health clinics, family health care clinics, companies. There's even private homes, community health centers, and much more. There's lots of jobs out there for all of our graduates. And this program does open the door to many options in the nursing field, as well as pathways for continuing nursing education. Fleming is very unique, and one way that we are unique and it's incorporated into the nursing programs is the Indigenous Perspective designation. And what this means is that we have Indigenous knowledge built into all of our courses throughout our program, so that students can gain that in-depth knowledge. However, students can take additional courses and complete events and initiatives around the college and community to complete the IPD and have it on their academic record. So students that get the IPD, they will have an increase in-depth knowledge of or in-depth knowledge relating to First Nations, Inuit, Métis peoples, and their cultures, their histories, traditions, and their contributions to our shared society. So IPD, it's very informative. So all of our nursing students in their first semester will have a mandatory general elective course. And the course code's Indig 49, Introduction to Indigenous Studies. And that is the first course to complete. If students would like to continue and complete the Indigenous Perspective designation and have that on their academic record, they will take the second Indig course either in semester 2 or 3 of the full-time program, and plus participate in some events and initiatives around the college. Once that's completed, it's attached to your academic record. So this is something you can consider. There's nothing you have to sign up for when you are accepting or enrolling into the program. You have the first semester to think about it. If you complete the Indig course and you love the information and you are excited about it, by all means, you would just register yourself in the second Gen Ed in either semester 2 or 3 and complete those initiatives. And it's an exciting and new in-depth knowledge for you. I'm just going to finish off with non-academic requirements. Non-academic requirements, or NARS, are a big part of our nursing programs to be successful. Non-academic requirements are mandated by our clinical partners, and each student has to have NARS requirements completed and remain compliant at all times to be able to participate in clinical each semester. For the practical nursing program, our clinical agencies need students to have the following NARS requirements at all times, and that includes completion of an immunization form, getting blood work done, making sure your hepatitis and your chickenpox and all those things are up to date. You will have annual TB skin test each year. You will have to have a vulnerable sector check valid every 6 months. Students are required to have CPR, level C, and standard first aid, as well as mass fit test. Students must have at least 2-dose minimum of COVID vaccinations. If you have more, great, but you have to have at least 2. And for international students, they must have a co-op work permit, okay? Students that are starting in semester 1 of either the PN full-time program or semester 1 of the part-time program, you don't need to have all of these NARS up to date and ready to go before you start. However, you need to have them done and uploaded into Synergy, which is a platform we use for collecting NARS. Students have to have them up to date in there by mid of your first semester. Okay, so you don't need to have them completed before coming into the program. However, it is strongly recommended that you started on them, at least that immunization form, getting blood work and everything done. And then depending on where you live, you might want to apply for that vulnerable sector check sooner than later, as the turnaround time for some districts can be quite lengthy. For CPR level, first aid, and mass fit testing, our continuing education department at Fleming College does offer these. Again, you don't need to have them to start the program. You will just need to sign up for them and complete them before the due date. By all means, students can take them externally from the campus as long as they meet the requirements. And lovely COVID vaccination, again, it's a 2-dose minimum. Okay, so those are our non-academic requirements. We do have a NARS coordinator as well that is very educated with all these different NARS. So if you have any questions or concerns, she is able to help and navigate through NARS. But just be prepared that you do need to get NARS all compliant. For students that are coming into semester 2 through the bridging program, Since clinical starts in week 3 of semester 2, the due date is prior to actually semester 2 starting. So students that are coming into the bridging program would need to have all their NARS completed and updated and get them into Synergy before the due date. Students that are not compliant with NARS are not able to go to clinical. They won't be given a clinical placement, and it will change their pathway through the program because you can't get to clinical. So they're very important part of the nursing program and student success in the program and moving forward each semester in the program. So no one likes to talk about NARS, but it's very important. All right, so little short there, but that's the PN program, those 3 different deliveries of nursing programs at Fleming, and what you can expect along the way. I guess I'll hand it over to you, Shannon.
Perfect. Thank you, Ashley. That was very informative. I know I learned a lot. So hopefully all of you did as well. We're just about to head into the Q&A portion of this presentation. So I will get everyone who has questions to just start putting those in the chat right now, and then we will take a look at those and respond to them. You may also have noticed we have another panelist joining us this evening. So Sol, I'll just give you the floor to introduce yourself.
Thank you so much, Shannon. Thank you everybody for joining today. Welcome to Fleming. Hopefully we have already your application or your prospective student thinking about us. So thank you again for taking the time to spend the evening with us. Thank you very much, Ashley. I did learn a lot too. Very informative. I'm Sol. I work in the international department. So I see there is one student joining us from Nigeria. Welcome. And if anybody has any questions or concerns, I'm going to drop our email address on the chat so you can connect with us. I know there are different considerations like the NARS, study permits, etc. So I'm just going to drop our email address there. And if you need anything, please connect with us. Thank you so much, both.
Perfect. Thank you, Sol. And again, I see we have some questions starting to come in. And okay, so the first one here, I can handle that one. So I'm taking the PNA program. What category do I fall into? So that's a fantastic question. We do also have a webinar Wednesday coming up in April that will discuss the high flex nursing program. So that wasn't necessarily covered tonight in the presentation, but there will be more material and another webinar that you can attend in April specific to that program. So what is a mask fit test? So Ashley, I'll send that one over to you there.
A mask fit test. So it's required by our agencies and our community partners. It's those fitted masks that we were wearing for like COVID respirators, right? So they're fitted rather than just a medical surgical mask. These ones are airtight. So we want to make sure that when you're going into like negative pressure rooms or infectious patients that are airborne, that the particles aren't getting through the mask. So there are a secure fit mask on the face.
Perfect. And it looks like we have a question here. Hi, I'm currently in the pre-health program at Fleming. Do you know what courses we get to drop? So Ashley, I can send that over to you.
I'm not 100% sure which ones you drop. Like if you are you in like a communications course, a general elective course? I'm not quite 100% sure, but those ones you would be able to drop. I'm not 100% sure what the curriculum is for pre-health sciences, but definitely if they're taking a communication 1 or communication 2, you would drop those 2. If you're taking gen eds, you would be able to drop those 2 in semesters 2 and 3 for the nursing full-time program. The rest are mostly nursing specific courses in the PN program. So
And it looks like we have a question, working Monday to Friday, 9 to 5, will I be able to manage part-time practical nursing program?
working 9 to 5, and that is part of the reason why we do have the part-time nursing program now, to be more flexible for students that do have other priorities and commitments like working 9 to 5. The only thing is with part-time program, all the courses are synchronous, where you have a timetable. You would need to be able to attend the lectures. Most of them are virtual now, but there are some that are on campus, and they're only offered one time a week. And labs are also mandatory participation each week. So for semester 1, there's one nursing lab for skills lab, and for semester 2, there's a skills lab as well as a health assessment lab that would be mandatory. So those are 4 hours each week. So it depends on how flexible your 9 to 5 job is. If it's Monday, Tuesday, Wednesday, Thursday, Friday, it might be challenging. You may want to attend the Wednesday webinar in April with our other program delivery.
Thanks, Ashley. And we have a question here. We have mask fitting testing yearly at my work, but they've been unable to fit me properly. What happens if I can't find a mask that fits?
That would be a good question for the mask fit people, but I know like the education or continuing education mask fit course at Fleming, they will only fit to the ones that our agencies use. So I'm not sure what agency this person works for and what mask they're being tested for, but you definitely want to find a mask that fits your face because that's what's protecting you. So maybe if you could email even maybe NARS at flemingcollege.ca, they may be able to answer that as well. But it is important.
I will put that NARS at flemingcollege.ca. We'll put that email in the chat as well. So if you do want to follow up and ask that question, you're welcome to.
They are the expert.
There we go. So it looks like for CPR level C and for a practical nursing program, would that be a course on my timetable or would I have to take it separately?
It would be taken separately. So you can take it through Fleming or you can take it externally. Some students may even have it already from their current or previous job. You just have to make sure that it meets our requirements and it is valid. But yes, it's a course that you could take on the weekends. There's some different organizations offer like a hybrid delivery. So you do all the theory on your own and then you can do the hands-on part with the organization. But it's outside of the program curriculum.
Perfect. Thanks, Ashley. And Sol, this is a question actually over to you. So how big or small is the international students community?
I would say that it is a mixed community, a very diverse. We have students from all over the world, from all continents. Obviously, our students from Canada, our domestic student population is bigger. But yes, we have an important international student community in different programs and from different countries. And we're proud to have you. So we do provide a lot of support through our International Student Services Department for anything from your visa and study permit to activities to connect, we meet other students, know Canada, travel around, see how beautiful our city and the surroundings are. Thanks.
Thanks, Sol. So another question here, can RPNs work in pediatric oncology?
That might be like a continued education. You might need to get different credentials for that. However, we are seeing more and more RPNs in specialized care. We're seeing them in a maternity. You are seeing them in, well, I work with excellent RPNs in the emerge department. So we are seeing RPNs as their scope of practice is increasing. We are seeing them in more specialty care for sure.
Great, thanks, Ashley. And this one is actually a great question. Maybe it speaks to some of your personal experience as well. So, what is the pathway for PN to RN?
PN, so PN to RN. So there's different pathways. It just depends on where you're at, if you can work while you attend school. But we do have a partnership with a few different universities, including Trent. Students that do graduate from the PN program at Fleming can apply for a seat over at Trent. They will have a reduced course load over there because they do accept some of our PN courses as transfer credits over there. So it does help reduce your course load. However, Trent, for example, is a full-time program, so you're required to attend the campus each day for the 3 years. Or there's other pathways as well where where students can go and practice and learn distance education, for example, NIPASing. But it just depends on where and how the student likes to learn, how they do best, and if they need to work while they are learning. So there's different pathways.
Perfect. Thanks, Ashley. And just to add to that, I will actually put the program page. I'll drop it in the chat here because there is a fantastic section on the practical nursing page. If you scroll to the bottom, there's a teal section that talks about our different transfer agreements and articulation agreements with other institutions. So you can certainly check that out to see where your credits, your Fleming practical nursing credits would transfer to a Bachelor of Science in Nursing program. So I will add that to the chat here.
I will also like to say, or to add to my previous presentation, that if you do have credits from other academic institutions like general electives, or you've taken biology courses, or you've taken communication courses, by all means, you can email transfer credits at flemingcollege.ca, and they will assess your course outlines and your transcript, and you could possibly get a transfer credit. And any transfer credit that you can get for the PN program, it helps reduce your course load. So one course is better than none, and it helps students. So if you've taken them, by all means, reach out.
Perfect. Thanks, Ashley. I'm just putting that email address actually in the chat as well. So transfer credit at flemingcollege.ca. Perfect. Okay, so just back to the questions here. It looks like part-time nursing starting in May. For semester 1, our classes online only.
I'm thinking what courses are exactly. I think so. I think is A&P, Anatomy and Physiology. There's a lecture and a lab. So the lab it should be on campus. The lecture is most likely going to be virtual. I'm trying to think what other courses there. But I think that one's it. Math is in semester 2. But maybe their communications is a 3 hours per week course. So I'm not sure what the delivery of communication is, because it's not a nursing course per se in the program, or it's in our curriculum, but not a nursing course. But I think there might be a 1 hour seminar on campus.
Perfect. All right, it looks like we have a question here. Does there happen to be any specific needles or medical requirements sent in before the program start date for incoming students in the September 2026 start?
No. So if you're starting students that are starting the full-time program in September. You are not required to have any NARS compliant by then. However, we do strongly suggest that you start working on getting them updated, especially your immunization form. So it's on our NARS page, or you can contact NARS at flemingcollege.ca. They can get you started with that, but you don't have to have anything started before, but it's definitely suggested.
Perfect. Thanks, Ashley. Can RPNs draw blood or only do IVs?
If it's in your scope of practice, RPNs do draw blood and emerge where I work. So I think it's just part of where you are working, where the RPN's working, and what education you, the facility or organization has provided to give you that scope of practice. But yes, they can do both with education. Yep.
Perfect. And so what are some of the things we will need in terms of laptops and notebooks before we start?
Definitely having a device that you can use Microsoft products on. You will need to use PowerPoint, Excel, Microsoft, Outlook for communication. Chromebooks are not maybe the most recommended, just because I don't know if they are compatible with our Respondus lockdown, which is our virtual testing for proctoring for testing, but definitely lots of people have iPads or MacBooks or Dell, just not Chromebooks is what I've heard. For full-time semester students, semester 1 students, there is in your tuition, it's your scrubs are included in your tuition. So you do get a top and pants, the Fleming nursing uniform, the scrubs, because scrubs are mandatory for clinical, as well as our nursing skills lab each week on campus. However, for skills lab, students can wear any scrubs, nursing scrubs, they don't have to be our uniform. But Fleming students do get a set of nursing scrubs in their full-time semester 1 tuition.
Perfect. Is RPN recognized across Canada as well as internationally?
You guys are graduates of this program will write the REXPN exam, and it's through the College of Nurses of Ontario. So you students are graduating and they are getting their registration within Ontario. As far as Canada, you'd have to, and going to the States, you'd have to, or internationally, you would have the applicant would have to do some further research.
Great, thank you. Could you work in labor and delivery as an RPN? If so, is there more education required to pass the PN program for labor and delivery?
Labor and delivery specifically, you may encounter it throughout the PN program through clinical. However, there's not more education required to pass or to complete the PN program. It's built in within the curriculum.
Perfect. So how many placements do you happen to do throughout the full-time program within the 5 semesters, and whereabouts do you happen to do them?
So semester 1, it's a 6-week clinical placement, and it's going to be long-term care or retirement. Semester 2 and 3 and 4, students do 12 weeks of clinical, 1 day each week, so 144 hours, and that could be community, our community, it could be in our hospitals, which it could be medical floor, surgical floor, rehab, mental health, yeah. And then our consolidation is the 400 hours, and that just depends on where the student would like to go. And again, they work with our clinical coordinator as well as our placement coordinator to get a placement that they're interested in. And that could be in and around Peterborough, or you could be closer to home if you live Ottawa or Hamilton. They work with the student to get them closer to home if that's what they would prefer.
Great. And would you recommend getting an iPad for this course, or should I just stick to my MacBook? So another tech question.
If you have a MacBook, stick with. If you have one already, I wouldn't suggest you don't need to run out to get an iPad. I would just honestly just stick with the MacBook, but it's completely up to you. Stick with it, and maybe once you start, maybe you'll see that the MacBook is perfect or that you want something different.
Perfect. And looks like a part-time question here. So 9 semesters for part-time. How many years / duration is it if I start this coming May?
So there's 3 semesters each year. So you're looking at 3 full years. Unless you take a break. Yeah.
And it just looks like there's a follow-up here to that, Ashley, and textbooks. So I'm assuming the question is about the textbooks required for the program.
There are resources that are required for the program. Each semester, there's more resources added. So the Fleming campus store has all of our resources where students can purchase the required resources. Some of them are still hard copies, and some now we also have like a digital package where students need to buy digital resources for our program. So those are additional cost each semester.
Okay, great. And it looks like, so there's a good question here. What will be the expected time schedule for the classes, and what kind of help is provided for the students to support academic success?
So each semester 1, for example, has 10 courses. It's heavy. And 8 of those courses are scheduled Monday, Tuesday, and Wednesday. So classes start as early as 8 a.m., most likely all 3 days. And they can end as late as 8 p.m. So it just depends on how many number of lab sections we have, how long those days go. Right now, this semester, Monday, it's virtual. Its classes start or lectures start at 8 a.m. and they finish at 4 p.m. So there are hour breaks between a couple of those courses, but they can be long days. Tuesday and Wednesday, again, they start early, around 8 a.m. and they can go as late as 4, 5, 6 o'clock, just depending. Every semester is different, so I can't guarantee what each term's going to look like. And sorry, you have to remind me, Shannon, what was the second half of that question?
Yeah, so the other half of that question, Ashley, and it kind of looks like the following question is similar. So what sort of supports are provided to students to support their academic success?
Fleming offers many different supports throughout the campus. We actually have student success coaches that we can refer students to. Students can also refer themselves to. And these support coaches know all the different types of supports and resources throughout the campus, specifically for their concerns. But we have academic supports, we have tutoring, we have organizations, we also have accessible education supports if students have IEPs or education plans from previous academics, where we can bring those over. So if students need extra time on test or quiet space, or if they have a disability that needs to be accommodated, it's all there for students to reach out to and to get the supports in place that they need, as well as excellent faculty and professors. We are here for students to make sure that we can support them wherever we can. As long as students reach out to us and communicate with us, we are more than happy to support them.
Perfect. Thanks, Ashley. And just as well, just to follow up on that, Ashley had mentioned the tutoring and academic skills department that we do have at Fleming College. So all students, every single student, can receive 2 hours of free tutoring services every week. In addition to that, there are drop-in sessions and workshops available for students. I know that there is actually a peer workshop specifically for nursing students, as well as an anatomy and physiology drop-in session. So those are some great resources to take advantage of as well.
Yeah, thanks, Shannon. Sorry, I should have mentioned that those the past sessions, and they are current PN students that are leading these past sessions, and they are for math, for nursing, and anatomy and physiology. But yeah, they're drop-in sessions. They're 1 hour each session, and they're engaging for students to participate and to learn within the group. So. And like you said, they're all paid for by your tuition, and so take advantage of them.
Perfect. And it looks like, so we've just got a couple more questions here. We are coming to the end of our session, but we'll definitely get to these ones because there are some fantastic questions. So another really good follow-up to that is, what would be the best advice in regards to any incoming students feeling nervous or even unsure of how the first semester will be with studying and with the workload?
It can be overwhelming. However, students making peer groups and study groups and just getting themselves organized with their timetables. There's also a resource through Fleming that takes all your course outlines and they put them together and to help organize your time. But just get involved in the program, engage in the program, as well as the college, right? Making friends and groups and participating in all the different activities around the college will help help make you feel more comfortable within the Fleming community. But just getting organized, asking questions, reaching out for help, all of those things.
Perfect. And I think we're just down to our last two questions. So second last question, I noticed in pre-health that they divided it into two sections for students due to class sizes. Is this usually the same structure for nursing?
So for the nursing program, all students for the full-time program, the bridging students and the part-time students, they're all together in the same cohort. They're all together in the same lectures for each semester level. However, for labs and seminars, students are broken down into 30, 32 students per group. So it's more engaging, working in those smaller groups for those classes. So that's fun. You also meet people, your peers, more personally as well, which is great.
Perfect. And then our last question here is, so I also work full-time 8 to 4, Monday to Friday. When is the webinar in April that you mentioned? Is the content covering how to work full-time and complete the part-time PN program? Is it a matter of asking the employer to be able to have 1 day off during the week for lab, etc.? Like you said, there are times during the day for courses. Don't know if it's manageable. Mary, thank you so much for your question. Actually, what I can do is follow up with you after this webinar to give you a little bit more information about when the High Flex Practical Nursing webinar will be delivered in April, the date. So if you're interested in registering for that, you're absolutely welcome to. And then Ashley, is there anything else you wanted to add to that? Just in terms of workload?
Yeah, working 8 to 4 Monday to Friday is a full-time job, and we always consider the nursing program as the full-time program is a full-time job. It takes full-time commitment and to be successful in the program. So however, I don't want to say it's not possible, but I think it's going to be a little overwhelming. However, like Shannon said, we have a high flex program that have started this semester with a webinar in the spring. That's something that you may want to attend just to get some more information, because that program delivery does offer flexibility, more flexibility.
Perfect. And it looks like Crystal, you as well. So I will, and Mary, I'll certainly follow up with you by the end of this week after the webinar about more information about that upcoming one. So sorry, there were so many fantastic questions tonight. I don't want to, end things, but we do need to wrap up here. So I just want to say thank you all so much for attending our Wednesday webinar about practical nursing. Thank you, Sol. Thank you so much, Ashley, for being here. Just two really quick things from my side. If you have any other questions, please feel free to reach out to us at askus@flemingcollege.ca or directly to Ashley, the PN coordinator at flemingcollege.ca. And then lastly, we do have an open house on Saturday, April 11th, where you have the opportunity to come to the Sutherland campus, see the simulation labs, the high fidelity mannequins that you'll be working on, meet Ashley, meet myself, meet Sol, and definitely see the space that you might be learning and working in. So thank you all so much, and this concludes our webinar Wednesday. So have a great evening.
Thank you.
Thank you, everybody, for joining. Looking forward